Hey, it's Mickey from Motion Restoration. So in today's video, I'm going to be showing you how to massage someone who's suffering from Achilles tendonitis. So if they're in the acute phase, you're going to be more so looking at the rest, ice, compression, elevation, a little bit of the effleurage light massage to the area, help to decrease that swelling, help to bring in some new blood to the area. The video today is going to be focused more on the subacute chronic phase of it. So we're going to be getting in quite deep to that tendon. So you're going to have your patient lying face down. If you are a massage therapist and it's within your scope of practice, make sure you open up those hamstrings. For today's video, we're going to be focusing mainly on the calf muscles as well as that Achilles tendon and into the bottom of the feet. So get yourself some lotion with a good amount of glidability or some coconut oil and let's get started. All right, so we have our patient is lying face down. We have a pillow that's going to be lying underneath the ankle here, so it's going to give it a nice softness into the Achilles here. If it is too flat, some people find that to be quite uncomfortable and it just compresses when the foot is lying flat. So just a nice light bend in it. All right, so we have our lotion. We are going into the calf muscles here. So we're just going to be warming up the calves. So like I said earlier, if it's within that scope of practice, I want you to get into those hamstrings and really open up this leg. So I'm just using the heel of my hand, going in through the medial and the lateral aspects of the gastrocs muscle. We're going in a little bit deeper as we get into the meat of that muscle. And then taking the heel, we're going to be scooping that gastrocs up. So I'm just taking the heel of my hand and I'm scooping up and pushing towards the knee. So our goal right now is to relax the calf muscles. So of course that big guy here, the gastrocs, is the one that inserts into the Achilles tendon. And then our Achilles, from the gastrocs, comes down and it goes into the calcaneus down here. So we're going to be hitting up this whole area. But the main goal now, we just want to relax these muscles. So these are called open C. So I'm just, again, picking up that muscle and scooping it up. Now my patient today actually does have Achilles tendonitis as well as a tear. So his is located right in here. So we are working today within this range. Now there are, of course the tendon is huge. So a tear can happen anywhere from here to here. You have a lot of area of that Achilles tendon. So it depends on where the person is noticing the pain. Now I've had people who have come in and their Achilles tendonitis is down here. So that's where you would be doing your focus. My patient is in here, but there's also times patients are in here as well. So it depends on the area where in the tendon that they have their tendonitis. So that is where you're going to be focusing your work. The beginning of it will always be relaxing the muscles of the calf. That is going to be your main focus. Now, if patient has the tendonitis is going to be below the gastrocs muscle, what we're going to be doing is we're going to be focusing our area of friction underneath the gastrocs head. So what that means is you're going to locate and find where the belly of the heads of the gastroc muscles start, and that is where you are going to be doing your massage. So for your massage, you're going to be focusing on minor frictions. So that is going up and down. So let me show you on this side. So we're going to find the gastrocs head and we're going to be frictioning up and down just below the head of the gastrocs where they're noticing the pain. So you're going to friction up and down, go all the way along both heads. And then what we're going to do is back and forth. So we've already friction up and down. Now we're going to go back and forth along the base of the gastrocs here. So working our way all along. Just like so. And then I like to go and I like to pick up that tendon and I like to give it a good squeeze. So I'm trying to pick up, so I'm picking it up, pinching it in between my fingers, and then I'm twisting it back and forth as I work my way down. So starting below that gastrocs, pick it up. I'm squeezing it on both sides and I am twisting it as I work my way down the tendon. And then we're doing little backs and forth right along all the way into the calcaneus. So do a couple of passes like that. Start at the base of those gastrocs, get underneath. We're focusing on picking up that Achilles tendon. Roll back and forth, trying to get underneath it. Working our way down. And then you're going to go both sides with your thumbs and you're just pushing. Right now we're going to focus on going down. So I'm just pushing along the sides of the tendon right now. Nice and slow, feeling areas of restriction on both sides. Going all the way up, I can feel the borders of the tendon on my thumbs. I can feel the muscles on the outside. Up to where the gastroc starts. So a few passes of that. Right now we're just focusing on pushing down. Trying to break up the adhesions that are along the Achilles. It's also a great time, check in with your patient. How you feeling? How is the pressure? All right, the unfun part. So this is now where we're going to be going in. So as I go up, I am pushing and squeezing the tendon in with my thumb. So it is always best to have no thumbnails. Try to cut your nails as low as you can because you don't want to harm the patient. So we're using the pad of the thumb, but a little bit more at the top. And I am really pressing in, nice and slow, keeping it on both sides. I'm pressing into my other thumb and I'm pushing my way up as I am pressing. This time we're going inwards. All the way up. And then I'm going to be pressing on the Achilles. So this time we're actually going to be going on, and I am going nice and slow so the Achilles doesn't pop out of my hand. And I'm just tracing that all the way up. Into the gastrocs. All right, so we're going to do more of our focus now where my patient has his pain. So now what we're going to be doing is we're going to be doing opposites, meaning we're going to be pressing in on the medial as well as on the lateral, but we're going to make it into an S shape. So as I'm pressing, you can see that it forms a little bit of an S shape into the tendon. So we're going to be pressing as we glide up. So then we're going to go opposite. So I find it easier if you're just going to be doing a finger and a thumb and then doing it opposite. So I find that easier. So I'm pressing in with my thumb as I'm pushing down. This time I'm using my middle finger. I have a little bit more pressure with that. So I'm just going one above, one below. And then we're working our way up. So we are trying to get rid of the restrictions and the adhesions that are on that Achilles where he's noticing that pain. Then I'm going to switch. Now I'm going to go, this one we're going to start lower, this one we're going to start higher. Really digging into that. Okay, and then I'm going to go on both sides. So right now I'm just pinching, but I'm a little bit more towards the surface of the skin. So this is quite difficult. So try your best not to slip up. So just keep that nice firm pressure and you're going to feel. So he has his tear right around here. So I can feel it because he's got adhesions now that are around it. So it's like a ball that's now formed along his tendon from his tear. So I'm just going to friction up and down along it. Same thing we were doing before, but I'm just going to go back and forth just along the spot that he has these adhesions. I'm just going to go back and forth. I'm going to go up and down. If he was allowed to talk right now, I'm sure he'd be going, "Oh my goodness," because it doesn't feel good. All right, so and then we're going to focus on just the inside. So I'm just pushing along the inside with my thumb all the way up. And then we're going to pull, pulling that Achilles towards myself all the way up. All right, so we've worked on top part of the Achilles, we've worked on the medial part of the Achilles. We are going to work our way into where our attachment points are. So the attachment points are into the calcaneus, or our heel. So it comes just underneath here. But again, I have had patients where they have had their tendonitis is going to be along the outside here or even on the inside. So what we're going to do is you're going to follow that Achilles, and I actually want to go just to the outside of it, and I'm just frictioning along the heel with the base of my thumb. And then we're going to go along the top here. Into the heel. Just frictioning back and forth. And then I'm going to do the same thing on the inside. So we're just going to be going along the side of the tendon here, just with the pad of our thumb. Into the heel. And then I'm going to be digging in with my thumb. We're going to be going up. I'm going to take it a little bit more medial. Take it a little bit more lateral. Do a few passes on the heel, both the medial side and the lateral side. Like so. And then get into, again, back into the main part of the Achilles. And I want you to go on either side. I want you to strip that up with your thumb. Again, either sides. So it depends on where they are feeling the pain. That will be where you concentrate the most. So if they have pain that has been diagnosed in the heel, that is where I want you to concentrate. The area that is tender for them, that is where I want you to friction. If they have the Achilles tendonitis is located in this section, that's where you're going to focus. If it is up here, that is where I want you to do your focus. But you have to do the entire tendon. You cannot just do point focus. You have to do the entire thing, because just because the pain is in one area doesn't mean that that is only where it is located. Make sure that you are hitting up the entire calf muscle all the way down into the heel here. So we're focusing on relaxing the muscles of the calf, and then we're going to be doing frictioning into the tendon and areas that are of pain. Then, of course, the end of it is always flushing towards the heart. So that was just a very quick video of how to massage someone suffering from Achilles tendonitis. Now, always check in with the patient to make sure that you are within their pain tolerance. This is not a comfortable thing to massage. We all recognize that. So again, my patient today had something a little bit extra. They do have a tear. Make sure that you are just working on the Achilles tendonitis. If they have something extra, make sure that they are within the healing parameter. They are not in an acute phase, they are more subacute chronic phase. Hopefully you found this video to be helpful with your patient that is suffering from the Achilles tendonitis. If you have any ideas for the next video, please feel free to leave it down in the comments below. Don't forget to like and subscribe, and I will see you in the next video.